Hello, my name is Dr. Carlos Carvajal from the CSU Podiatry Service, and I know dealing with an abscess, with a foot abscess, could be pretty stressful for the owner. So today we're going to talk about some tips and tricks that you can do when you're at home waiting for your professional, for your equine professional to take a look on that abscess. Something that you could do to communicate better with your farrier is to take a nice video about your horse. When you can see the whole horse, I want to see the head, I want to see the whole limbs, and we can walk him just a few steps. And if you can send that to your vet, that is going to give you enough information to start diagnosing that abscess. If the horse is reluctant to move, you don't want to push him too hard to walk, just try to give him a few steps and that will be enough. Something that we also have to do when we're thinking on an abscess is to clean a lot deeper than we used to do our feet. Just use a hoof pick, go pretty deep on those crevices that the foot could have, and also use a wire brush that is gonna clean the foot a lot nicer. So while you're doing this, and once you're done cleaning, you want to check all the Y line, check the foot all the way around, look for any pus or any drainage that you could have around. We can have blood, pieces of rock stuck in the foot, so make sure the foot looks nice. And once you're there, you can take a nice photo for your veterinarian in this angle, having it with a lot of light, pretty close to the foot. We take a photo and you're getting some information for your vet. On the dorsal wall, we also want to clean it pretty nice. Make sure there's nothing covering the hoof wall, and you're going to use your fingers to make some gentle pressure around the coronary vent, looking for any reaction. If we get any reaction on some area, that will give us a lot of information too, and we can start thinking on where that abscess is going to pop. Once you have cleaned the bottom of the foot, you can use your thumbs as well to make some gentle pressure all the way around the foot. Also looking for any reaction that you could get, include the heel bulbs, and just share that with your vet, and that is going to give us a better idea of where we're at. Right on both sides of the fetlock, you're going to find the digital artery that may have increased digital pulses if there's some inflammation in the foot. So it's also good to get familiar with that. You can do it at home, feel when your horse is healthy, and look for that little pump of the artery. In that way, when there's something weird that is happening in the foot, like an inflammation or a foot abscess, you will be able to notice a difference if there's an increase in those pulses. Taking nice photos of the feet like this, right at the level of the ground, is going to give us a lot of information too. So make sure you take nice photos where you can see all those details, so your farrier can start guiding you on the diagnosis of this horse. From the top, you want to be completely with the same angle of the dorsal wall on your phone, so just take a photo like that. Make sure there's nothing on the ground and it's on a flat surface like a concrete area. That would be ideal for a photo, and send it to your vet. Once you have sent all of that information to your vet, he or her may ask you to start doing some little things that will help your horse through the process while waiting for the professional to do the full exam. So for example, he will ask to do some soaking on the foot. That is going to help us to moisturize the foot and hopefully go to find that abscess a little earlier, or to mature the abscess to get the drainage real quick. So for example, most common thing, just some warm water and Epsom salt. You can put some betadine in it. There's some products specifically for soaking. So you just have to grab a bag, plastic bag. There's all kinds of bags. This is an IV fluid. You can ask your vet to give you some while they're on your farm, but this is the way to do it. Make sure you're close to the stall before you put it on, so whenever they're ready with the soaking, you can just walk them straight to the stall. You can put some tape around, make sure it's not really tight, and we're not making a tourniquet on that, but you're just gonna leave it like that, leave it for 20 minutes or so, and then take the bag off, dry the foot, and probably put a foot pack. After 20 minutes or so, you're ready to take the soak off. Just take the bag off. Dry your foot. And it's probably a good time to put a foot pack. So you have probably seen a lot of videos like this, but you can make a patch out of that duct tape. I like to use 2 layers, so just go on the other direction. There's some products that you can use to poultice the foot. Your vet is gonna give you directions about it, but make sure you're using some kind of padding. So you will basically put that poultice on the area that you're suspecting the abscesses, or even cover the whole foot, and then start wrapping it like that. If you make like an X movement or shape right here, it's gonna help you to hold the foot pack in a better way. Once you have that padding, you can use your bed wrap and do the same shape, going in an X, going at the toe, covering the whole bottom. And then at the end you just put the patch of duct tape that you previously made. Just secure it with a few rounds all the way. While we're dealing with these type of foot problems, sometimes putting a boot on top is just gonna help us to increase the comfort of the horse. So it's pretty easy to put on, and it's gonna provide a lot of comfort. Make sure it's the proper size. Make sure the heel bolts are pretty well covered, but not with a lot of pressure. They have this Velcro that you can put in, and that is also going to help us to wait for your vet while the horse is having these foot problems. Dealing with a hoof abscess, it could be pretty simple, but also it could have a lot of complications. So just make sure that you consult with your podiatry expert, and we're here to help you.